Yeah, thank you very much for the introductions. Today, I would like to introduce antioxidant treatment for long COVID and messenger RNA vaccine side effect. There is a huge number of the patient COVID-19 infection exist. And then it's so said 5 to 15% of that infected people had a long time uncomfortable symptoms. That's called long COVID. And at the same time, many people who had injection of messenger RNA vaccines also have side effects. And then both are very similar symptoms. First of all, oxidative stress is originally NOx, it's a gas. That's changed very quickly to the different materials. The final product I would like to introduce, one is hydrogen peroxide. This is a kind of detergent like a Clorox, used for that cross washings. And then hypochlorous acid that is used for that disinfections. And these two materials are produced in our body, especially in that white blood cell, neutrophil, using this material and the enzyme to destroy bacteria or virus which phagocyted. And then that meaning is if you have some overexpression of oxidative stress, you have a high level of like how to say, it's a bleaching agent. So it is easy to understand that if you touch to the hydrogen peroxide, your finger is turned to white and start irritations. So increased oxidative stress has inflammations whole of your bodies. And then there is many publications about oxidative stress increase and then immune system decreases. Because oxidative stress damage on our immune systems. I invented the antioxidant compound, Twendee X, that is consists with that L-glutamine, vitamin C, L-cystine, coenzyme Q10, succinic acid, fumaric acid, vitamin B2, and niacin. It's a very simple ingredient, and then you can find that all these into the near drugstore and pick up some multivitamins or multi-amino acids, something like that. But my composition has a very special mix change. And then I had many patents about these compositions. And then the Twendee X have proven by ICDD. This is a French company who provide oxidative stress test. And then this data was done at 2014. And then Twendee X decreases oxidative stress in mitochondria 63%, in the cells 45%, and then increasing the superoxide dismutase SOD in the mitochondria 147%. So at that time, CEO of ICDD told me Twendee X has the strongest antioxidant effect in the world. Of course, it's no side effect. And finally, we succeeded the clinical experiment using Twendee X to prevent mild cognitive impairment. This study is multi-center, randomized, double-blind, and a placebo-controlled prospective interventional study. This is a very difficult, actually most difficult clinical trial in these experiments. And then the Twendee X finally, after the 6 months intake, increased the MMSE score and the Hasegawa scores as well. And then this shows a result of the asthma patient questionnaire monitorings. left-hand side graph shows that before 20x 4 months, and the patient shows red line is over, red color is over 11 and 10, 9, 8, 6, so that almost half patient have more than 6 times asthma attacks. And then on the other hand, after 4 months later, the patient answers that total number of asthma attack is dramatically reduced because 0, 1, 2 time is almost half. And then as you see that the red color is coming to almost half. This experiment shows cancer metastasis in nude mice using human cancer cell lines. And then the cancer cell line produce oxidative stress many because they try to survive. And then cancer cell producing the oxidative stress to damage on host immune systems. And then in this experiment, control showed that just only metastasis, and then the Twendee X group showed they administered 4 weeks of Twendee X in drinking water, so that the number of the cancer metastasis dramatically reduced. And then as you see that mouse weight, body weight is like 20 grams. But only cancer metastasis group shows lung weight is 1.33 grams. And then the Twendee X group reduced to that lung weight 0.36. So difference of that 1 gram of that cancer tumor itself. And then in this experiment, Twendee X reduces that oxidative stress. This is the level of the hydrogen peroxide. Dramatically in these mice metastasis models. And then our immune system, natural killer cell activity, NK activity, is very important to fight the cancer cells. And then it was reduced by cancer metastasis, and then increasing almost double in the Twendee X group. That meaning is Twendee X reduces oxidative stress and then same time increasing that immune activity double. So this is a change in the intestinal flora. This is testing in with rat, and then Twendee X was administered with OPP. OPP is anti-fungus anti-fungus for that used for that oranges, and then Twendee X and then OPP show that increase that variety, I mean flora diversity was increasing, and then also that bacteria, Akkermansia species is so-called good bacteria, and that fight with that inflammations, and then you see that. Twendee X administered with OPP is increasing that number of that Akkermansia species. That meaning is Twendee X work once that the threat, I mean that damage coming, works very good for that floral diversity, and then also that increasing that good bacteria species. And then from this evidence, Twendee X reduces oxidative stress that protect immune cells, increasing doubles natural killer activity, increase diversity of the intestinal bacteria, increase Akkermansia species, which has anti-inflammatory effect. That meaning is very good for our bodies if something happened. So this slide shows publication from 2020. It's already 2 years ago. And then this slide showed once COVID-19 infected the human, first point is a nose, in the throat or something over there, but they quickly spread into the lung, and then starting producing lots of ROS. This is reactive oxygen species. This is oxidative stress. And then too many ROSs coming, our body have a huge problem. One is so-called immune disaster. Some people had a very quickly turn to severe conditions due to that immune deficiency. And then also that damage, also that each organs, like heart, liver, kidney, and then also that that damage, ROS damages in the internal internal surface cells of the blood vessels that cause blood clot. So that many disease and symptoms will be coming. So here is a long COVID and then vaccine side effect things. Long COVID and the vaccine side effect is a very similar symptoms like CFS. CFS is chronic fatigue syndrome. And then till now, chronic fatigue syndrome is not well known about why they have such a variety of the symptoms. But now it is clear that one of the reasons starting chronic fatigue syndrome was virus infections. And then for the long COVID and the vaccine side effect, no specific abnormal exam data. So like a blood parameter or something like that. And then severe patient cannot move from bed. And then I saw that many severe conditions, long COVID patient have self-terminated their life. And then many patients lost school or jobs, and no effective therapy exists. And then this is a very important part. Government does not support patient. Even they recommended vaccine injections. So I will a little bit about talk about that chronic fatigue syndrome. This is a totally different study, which is questionnaire monitorings, and then detailed data will be presented tomorrow by Dr. Yo, my colleague. And then here is some monitoring things: fatigue, muscle pain, joint pain, sleeping disorders, decrease in the memory and the concentrations and the headaches. And this is these 6 parameters is the main symptom of chronic fatigue syndromes. And as you see, 4-week intake of the Twendee X, patient was reduced at these symptoms. This is a scoring 0 to 5, and then you see that almost all are coming to half. So this is a very important point. Many people try to using an antioxidant supplement or pharmaceuticals to reduce these symptoms. And the muscle pain and the joint pain is very, very difficult to reduce. So this is the first data in the chronic fatigue syndrome patient have a improvement. So, and the character of the COVID-19 is elderly and with primary basic disease coming to severe and die. Elderly and basic disease cause high oxidative stress, and high oxidative stress damages the immune system, as I mentioned. Antioxidant reduces oxidative stress and recover the immune systems. So, and then COVID-19 induces interstitial pneumonia. This is a kind of allergic reactions. This is not only from the virus infection. This is allergic reactions. So, and then this year, we published that this manuscript, effect of antioxidant composition Twendee X on side effect of messenger RNA vaccines. And then Twendee X 4 weeks, oral 3 capsules once a day was administered to the 149 patient, and then patient responded in monitoring questionnaires. And then here is 8 parameters: fatigue, breathing difficulty, chest pain, smell and taste disorders, headache, brain fog, joint pain, and dizziness. And then this is only severe conditions, patients. Score is 0 to 5, so that 3, 4, 5 patients are listed. As you see that all parameter is going down to that half or below half with significance. So that in these patients, antioxidant therapy was effective. So another publication is very similar, but the target is long COVID symptoms. This is the same, but in this study, 126 patients participated. And then this is also same data and similar data and in the same parameters. As you see that all parameters going down to half. That meaning is long COVID and then vaccine side effect is very similar, and then all caused by from oxidative stress. This is definitely, I think. But to prove that this is a questionnaire monitorings, double-blind testing is required. And then our team tried to do such a double-blind experiment. However, in the long COVID disasters, no company could do that such a research. So this is the conclusions. Long COVID and the messenger RNA vaccine side effects are oxidative stress disease. Antioxidant therapies are effective for symptoms of long COVID and messenger RNA vaccine side effects. So Twendee X is produced by TIMA Tokyo Incorporated, and they are happy to deliver free samples of Twendee X for these people who suffer around the world. Thank you very much.